Fetal alcohol syndrome, symptoms and prevention. If a baby has exposure to alcohol in the womb, they can develop a range of conditions known as fetal alcohol spectrum disorders. The most severe of these disorders is fetal alcohol syndrome, or FAS. Fetal alcohol syndrome is a type of disability and it does not have a cure. However, with early identification and support, children with fetal alcohol syndrome can learn important skills that can aid their development. In this video, we look at why fetal alcohol syndrome occurs and its symptoms and risk factors. We also discuss how people can prevent fetal alcohol syndrome and when to see a doctor. What is fetal alcohol syndrome? Fetal alcohol syndrome occurs when a fetus becomes exposed to alcohol. This exposure typically occurs when a pregnant person drinks alcohol and it enters the fetus's bloodstream through the umbilical cord. As a fetus's liver is not fully formed, this organ cannot metabolize alcohol. As a result, when a fetus becomes exposed to alcohol, they absorb all of it. Alcohol is a teratogen, which means that it is toxic to developing babies. Teratogens can interfere with a fetus's growth and development, particularly that of the central nervous system, which includes the brain and spinal cord. Other types of fetal alcohol syndrome disorder include alcohol-related neurodevelopment disorder, alcohol-related birth abnormalities, neurobehavioral disorder associated with prenatal alcohol exposure, partial fetal alcohol syndrome. Signs and symptoms. Fetal alcohol syndrome can cause a range of physical, mental and behavioral complications. This range from mild to severe and may include physical signs: low body weight, below average height, poor coordination, small head size, small eyes, abnormal facial features such as smooth skin between the nose and upper lip, thin upper lip, bone deformities, especially in the fingers and limbs, heart, kidney or bone problems, vision or hearing problems. Behavioral signs: hyperactive behavior, sleep problems, difficulties suckling as a baby, trouble regulating emotions or behavior, resistance to change, inability to emphasize or recognize indirect social cues. Learning and cognitive difficulties: difficulty remembering, trouble paying attention, finding school challenging, especially subjects such as math, intellectual disabilities or low IQ, speech and language delays, poor judgment and reasoning skills, trouble planning or being organized, difficulty understanding cause and effect. A child with fetal alcohol syndrome will not necessarily have all of these symptoms. Additionally, many of these symptoms can occur due to other conditions. A healthcare professional specializing in fetal alcohol syndrome can help determine the cause. Complications: people with fetal alcohol syndrome are more likely than other people to develop certain mental health symptoms and conditions, including anxiety, depression, low self-esteem, attention deficit hyperactivity disorder or ADHD, substance abuse disorders, As a result, they may experience difficulty living independently later in life. Secondary complications that may arise as a result of fetal alcohol syndrome include low academic achievement, disrupted or incomplete school experiences, difficulty staying employed, trouble with the law and other authorities, substance abuse problems such as alcohol or drug use disorder, inpatient treatment for mental health or substance abuse. However, these complications are not inevitable. Certain proactive factors can reduce the impact of the secondary effects of fetal alcohol syndrome disorders. They include early diagnosis and intervention, special education tailored to the child's needs, support from social services, living in a caring, nurturing, loving, and stable home environment during childhood and adolescence, learning healthy ways to express anger and frustration, having a home environment free of violence and abuse. Risk factors. Generally, the more alcohol a person consumes during pregnancy, the higher the chance of fetal alcohol syndrome. The frequency, strength, and quantity of alcoholic drinks have an effect, as well as the timing of consumption. Drinking alcohol late in a pregnancy increases the likelihood of fetal alcohol syndrome. However, while higher amounts of alcohol are more harmful, there is no known amount of type of alcohol that is safe to consume while pregnant. All alcoholic drinks, including wine and beer, have a similar effect on a developing baby. However, alcohol may affect a fetus more significantly if the pregnant person has malnutrition, smokes, is older, has a below average body mass index or BMI, has a personal or family history of substance abuse, has had multiple pregnancies or births, has a lower ability to process alcohol. Some research suggests that a pregnant person's environment may also play a role. Living in stressful, isolated, or adverse conditions may increase the chance of fetal alcohol syndrome. Prevention. It is important that both individuals and healthcare professionals understand their role in preventing fetal alcohol syndrome disorders. For people trying to get pregnant, if a person is thinking of having a baby, it is important that they know ahead of time that they will need to avoid alcohol during the months when they are trying to conceive, during pregnancy, while breastfeeding. In many cases, this will mean avoiding alcohol for more than a year in total. For accidental exposure, it takes most people 4 to 6 weeks to confirm that they are pregnant after having penetrative sex. Therefore, people who are trying to get pregnant may be pregnant for 1 month or more without knowing it. Sometimes this means that people drink alcohol without realizing that they are pregnant. If a person drinks any amount of alcohol during pregnancy, the Centers for Disease Control and Prevention (CDC) recommend that they stop drinking alcohol as soon as they can. Talk with a doctor or prenatal specialist about any concerns. Get regular prenatal checkups. For people struggling with substance abuse, if a person who wishes to get pregnant or is pregnant finds it difficult to stop drinking, It is important that they seek help as soon as they can. A doctor, counselor, or therapist can create a harm reduction plan and support system to help the person start to reduce their alcohol consumption in a healthy way. When to consult a doctor? It is essential to speak with a doctor as soon as possible if a child shows signs of fetal alcohol syndrome. Early identification can improve the outcome for children with fetal alcohol syndrome and raise their quality of life. It is best to speak with a doctor who specializes in fetal alcohol syndrome, such as a developmental pediatrician, clinical geneticist, or child psychologist.